Cannabis and pain. Is there evidence that opiate-based pain medications could be reduced or even ceased by using medical cannabis? Could we have an answer to our opioid epidemic crisis? What about the other important patient questions? Could medical cannabis improve a patient's quality of life, their bodily pain? How about physical and social functioning? And is there significant data? Hey guys, I'm Dr. Thomas Hankey, medical doctor and expert cannabis physician, consultant, and coach. In this video, we'll be discussing these questions and the evidence-based medical research addressing if cannabis is able to provide some answers, and any scientific data to support such claims. Let's take a look. What do we already know? The number of deaths in the United States due to opioid overdose has quadrupled over the past 20 years. Over 500,000 people have lost their lives due to opioid overdoses, according to the CDC National Center for Health Statistics. From the year 2020 to 2021, opioid overdoses have increased by 28%. But as medical cannabis has been introduced, there have been plenty of studies reporting a drop in opioid use, indicating a harm reduction role. However, studies are limited which examine the actual health functioning and quality of life in medical cannabis patients, and in those who have been able to reduce or cease using their pain medications with the help of medical cannabis. The research article, Medical Cannabis Patients Report Improvements in Health Functioning and Reductions in Opiate Use by Pritchett, 2022, may have the data we have been looking for. I'll be using simple language to discuss the main points of this study. We'll cover the purpose of the study, how it was designed, the results, limitations, and conclusions. We'll also discuss some possible implications and how this may impact your future discussions about the role of cannabis in our lives and community. Let's begin. The purpose of this study was to report on the medical cannabis usage, perceptions of health functioning, and changes in opioid pain medication use in Florida medical cannabis patients. The study was a cross-sectional observational study in which data was collected retrospectively within the first year of access to prescription medical cannabis. Participants were patients on the Florida Medical Marijuana Use Registry who were prescribed medical cannabis at the time of the study. They were recruited through flyers provided at one of 17 licensed Florida dispensaries and compensated with a $5 credit. The researchers developed a 66-item survey which assessed demographics, medical conditions, health functioning pre- and post-cannabis use 1 year after access, as well as opioid-based pain medication use and the perceived benefits of cannabis pre- and post-initiation of medical cannabis. In total, they collected their data from 2,183 consenting respondents. Yes, this was a large study with a good sample size, which has potential to return strong and reliable results. So, what were the results of this study? Let's talk about quality of life and health functioning first, then we'll look at the results for pain medication use and the potential role in the opioid epidemic. Health functioning of patients was assessed before and after initiating medical cannabis use. Comparisons of the pre- and post scores using paired t-tests indicated significant differences after initiation of medical cannabis use, with all health functioning domain scores showing significant improvement, with a p-value of less than 0.0001. Health functioning improved in areas of bodily pain, physical functioning, and social functioning. over 90% reported that medical cannabis was very or extremely helpful when dealing with their medical condition. And over 85% reported cannabis was extremely important to their quality of life. The results for pain medication use before and after access to medical cannabis is displayed in their tables 4 and 5. Table 5 shows 60% of patients reported using opiate-based pain medication prior to medical cannabis. A large portion of those patients used pain medications for 2 or more years prior to medical cannabis access. Over 90% of those who used pain medication prior to the study reported a change in their use after beginning medical cannabis. Majority reported substantial reductions or complete cessation of pain medications as a result of medical cannabis, with some patients specifically describing improved functioning in daily life as a result. Reported use of the most used opiate-based pain medications, oxycodone acetaminophen and hydrocodone acetaminophen, were reduced 5-fold. Most respondents had only recently begun using medical cannabis, indicating medical cannabis could encourage changes to opiate-based pain medication use soon after legalized access. How does this impact the opioid epidemic? These results show that opiate-based pain medications may be reduced or even ceased, especially in patients with chronic pain. This means medical cannabis could be a viable alternative to pain medications, and the data suggests that some patients decreased opioid use without harming quality of life. Therefore, initiation of medical cannabis laws could lead to public health changes through the potential opioid-sparing effects of medical cannabis without worsening health functioning. At the community level, medical cannabis could have a more immediate role in managing the opioid epidemic than previously thought. Let's discuss the statistical significance of the results and any limitations or potential bias of the study. Multiple linear regressions were performed in each health functioning domain to explore how the post-domain score would change based on the pre-domain score to help provide a clear picture of the comparisons. Paired t-tests were conducted to check pain medication use and to compare the scores of health functioning domains before and after medical cannabis initiation. All resulting p-values were less than 0.0001, which obviously correlates with the resulting data being statistically significant. The study, like all studies, did have a bias and limitations. This one used an anonymous cross-sectional self-report survey, so medical records or corroborating information on medical conditions was not possible. Reports of changes in health functioning prior to and following initiation of cannabis use were collected cross-sectionally as well and may be subject to recall bias. Although there are some studies which have shown the reliability and validity of this type of bias to be acceptable. A small number of respondents reported longer-term use of medical cannabis, which may exaggerate recall bias. All participants were active users of cannabis, and data did not capture medical cannabis patients who chose to discontinue cannabis use. So, some deductions. What's the really important information? Despite these limitations, the results from this large sample indicate that medical cannabis may play an important role, both at the individual and community level, by being a viable alternative to opioids when managing pain. In all, these data add to the growing body of literature suggesting that medical cannabis use may be associated with reductions in opioid and other prescription medication use without reducing quality of life or worsening health outcomes. Most patients who had used pain medications prior to initiation of cannabis use reported either cessation of all pain medications or considerable reductions in their use. This is especially notable when considering that almost half of these patients had used their pain meds for 2 or more years. The evidence shows that some patients may reduce or even cease use of opiate pain medication upon access to medical cannabis, potentially without harming quality of life or health functioning. This is suggestive of the harm reduction role and opioid-sparing effects of medical cannabis. Importantly, the community-level findings indicate that medical cannabis could have a positive impact on the opioid epidemic public health crisis by being a viable alternative to opiate pain medication soon after legalization. Given the great individual and societal costs associated with the opioid crisis, the public health implications of these findings are important to consider. How does this contribute to the medical field? What does this mean? Well, we already know through multiple other studies about the physiological relationship between medical cannabis and pain. But now we can discuss research on medical cannabis as an effective and safe alternative to opiate-based pain medications. In my own opinion, this means we should stop complaining and scratching our heads over this opioid epidemic and start placing a greater emphasis on conducting the research that is necessary and the studies that are necessary to safely integrate cannabis as an alternative or additional option for patients, both before pain medications are prescribed as well as after. Most importantly, to lend help for any person who is struggling with opioid medication, and so we can start making reparations to this terrible and devastating opioid epidemic we have created. If you would like to review the article, I have attached a link for reference in the description to this video. Do you think it's time we started to demand fast-tracked legislative changes so the proper research and clinical studies can be carried out for us to make changes safely and legally? Let me know what you think in the comments, along with any thoughts or additional research you would like me to review. Cannabis and pain is a big topic I talk about all the time, reviewing the role of cannabis and pain. I'll be discussing more cannabis research and the effects it has on dozens of medical conditions in each new video. If you're interested in learning more of the evidence regarding medical cannabis, you'll be able to see when my next video is released by hitting the subscribe button and ringing the bell. It really helps more people find these videos and helps my channel reach more people. I'm extremely grateful for your support. Again, my name is Dr. Thomas Hankey. I hope you're having an amazing week. I love you. I'll see you next time. And until then, keep an open mind.